Hi, my name's Nikki Grosskopf, and I'm going to be doing a head to toe assessment for you. So this is my patient Lucas, and he's going to be a great patient for me. I'm Nikki. I'm going to be your nurse today, and we're going to do a head to toe assessment. So first, we're going to start with the cranial nerves. So we're going to start with sense of smell. So if you can blow out your nose for me and get all the mucus out of the way, start with that. Okay, and then we're going to do a sense of smell. So if you can close your eyes and plug one nostril, and I'm going to have you smell. And tell me what you smell.
Vanilla.
Good job. And then the other nostril. And then ideally I would have something different to smell, but
Vanilla.
good job. We'll go with that for today. Okay, so that's cranial nerve number 1. Cranial nerve number 2 was the Snellen test that we performed previously to coming into the office. That's the eye test that you performed. We're going to do cranial nerve number 3, 4, and 6. So I'm going to check your eyes now. So go ahead and just look right at me. Good job. Okay, his pupils are equal and reactive. They accommodate to light. They're about a 3 right now, and they both respond very well to light. Can you watch my finger without moving your head? Good job. Okay, his ocular movement is fine. He can move his eyes in all different directions, and that checks those nerves. We're going to move on to nerves 5 and 7. Can you puff out your cheeks for me? Good. And then big teethy grin. Smile up. Frown down. Good. And then wrinkle your forehead. Good job. So he's moving all of his facial extremities. We've got symmetry in all of these movements. That's good. Now we're going to test for sensation. So close your eyes and tell me if this is dull or sharp.
Dull.
Okay. What about this?
Sharp.
Good job. So that tests for sensation. And then the last thing with these is, can you open? Close, open, close. Do you have any pain? Okay, no pain, no popping or movement in the joint. That checks for TMJ. So moving on, we're going to check cranial nerve number 8. So 8's going to be hearing. I'm going to step 1 to 2 feet away, and I'm going to whisper. You're going to tell me what I say.
Blue truck.
Good job. And then I'm going to come over here.
Red truck. Red truck.
Good job. Hearing is intact. So then we're going to move on to cranial nerve number 9, 10, and 12. And this is going to be, I'm going to have you stick your tongue all the way out. I'm going to grab a flashlight real fast. So stick your tongue all the way out. Good. And say, ah. So I can check all the way into his mucous membranes. Everything looks fine and intact. He can move his tongue in and out. Can you put it back in? Teeth looks good. Lips are pink. The back of his throat looks good. Tonsils are okay. Uvula looks good. All that looks good. If I had a Q-tip, I could stick it back and get a gag reflex and test that as well. And all of that looks appropriate for now. So now we're going to move on to cranial nerve number 11 is the one that we missed. So if you can shrug your shoulders up and down, and then I want you to lean and push against my hand. Good. And push. Good job. So all of his cranial nerves are intact. Can I get you to do some rapid movements for me? So I'm going to have you do fingers as fast as you can. Good job. Now we're going to go palms down and palms up as fast as you can. Good job. Okay, so we've got some fast rapid movements, and then what I'm going to have you do is close your eyes. I'm going to hand you an object, and you're going to tell me what it is.
The TV remote.
Good job. One that you know well. So this is going to help me do spatial awareness, and parietal brain lobe attachment is all intact. If you close your eyes and put your hand out, I'm going to do a test where I draw a letter on your hand, and you're going to tell me what it is.
A.
Good job. I'm going to do another one.
C.
Good job. Okay, so that helps me know that he's got primary sensation and cortical sensation. Okay, can I get you to stand up? We're going to do a Romberg test. So first we're going to assess his balance. So if you can take just a step back. Yep, and we're going to have him stand. Now close your eyes, and then you can do this either with your hands down this side or you can cross your chest. And we're going to give him like 30 seconds and assess his balance, make sure he's okay. And then I'm going to give you a little push and see if you can maintain your balance. Good job. So that's a negative Romberg test. So that means that he balances just fine. Okay, you can open your eyes. Can you stand on one foot for me? Good job. And the other foot. Good job. His balance looks good. If you can come stand over here, I'm going to have you walk on your heels all the way across the room. job. And can you walk on your toes on the way back? Good job. So he moves all extremities and step forward here. It is appropriate there. Can I have you remove your shirt? All right. And then turn around. I'm going to have you lean all the way down and touch your toes, like you're going to touch your toes. So this is a good scoliosis strain. We make sure his spine is nice and straight and everything looks good. Okay. I'm going to have you sit, well, have you sit this way. So we're looking at skin and head and eyes and all of that. So we've kind of been looking at his skin this whole time, and I haven't seen anything too in particular. He's got a few little abrasions on his foot, on his toes, but other than that, he's pink, he's well perfused, everything looks appropriate. So we're going to start with his head here. Do you have any painful spots?
Nope.
Any problems there? I'm going to go all the way to the back and come down. I'm going to check for lymph nodes in the front and then down the sides here. No painful marks. Everything feels appropriate. I'm going to check for a carotid pulse. He's got a good carotid pulse on both sides. Can you put your head all the way back and swallow? Good job. And you can see how the muscles move up and down. He has no tenderness, pain, lymph nodes are all okay, so we're not concerned about thyroid issues. I'm going to get my otoscope that I don't have, and we're going to check ears, and we're going to make sure the eardrum is intact, that everything in his ears looks okay. And we're going to have you tilt your head back, look up your nose, and look for deviated septum and mucous membranes, and all of that looks appropriate. Okay, all of that looks good. I'm going to listen for carotid burritus. So I'm going to flip it using the small side of my stethoscope, and I'm just going to listen for a good blood flow through the carotid artery. And it sounds like he's got good blood flow through, no burritus or no turbulent flow, so it all sounds appropriate. Okay, can I have you stand up? I'm going to move your chair a little bit. I'm going to have you sit with your back towards me and start on a posterior exam. So we're going to start listening to lung sounds. You can go ahead and take a couple deep breaths for me. Good job. Nice and slow. I don't want you to pass out. Good job. Good job. And he's got equal breath sounds on both sides. He's got good aeration throughout, all the way down into his bases. Another thing I can check for if I'm concerned about consolidation is fremitus. So I'm going to have you say 99.
99.
Good. And say it again.
99.
Good. And again.
99.
And it resonates perfectly. It sounds good. The other thing I can do if I'm concerned about pockets of consolidation is I can have you do the whisper test. Can you whisper 1, 2, 3? Good job. And again. Good job. And that can help me identify consolidation. The other thing that I can have you do is the echophony. So if I can have you say E.
E.
Good job. And say it again.
E.
Good job. And if there was consolidation there, you would hear the E would sound more like an A, which he sounds good and appropriate. Have you sit up, and there's no, you have any vertebral pain anywhere along your spine. So I'm going to come down below this 12th rib here, find where it is, and I'm going to palpate for CVA tenderness. Any tenderness?
Mm.
Okay. That side?
No.
Okay. So no tenderness in there, no CVA tenderness. Okay, go ahead and stand up. You can turn around. I'm going to do the front now, an anterior assessment. So I'm going to go ahead and listen to breath sounds first. Good job. One more. Good job. And he sounds nice and clear throughout, just like he did on the back. So next I'm going to assess his heart. So I'm going to find, first the aortic valve is where I'm going to listen to first, which is just to his right of his sternum, right here under the second rib. I'm going to listen to that for a second. And then I'm going to move to the left and listen to the pulmonic valve. And then just below it's going to be Erb's point, which is the second pulmonic. And then we're going to go down and slightly out, and that's going to be the tricuspid. And then right at the bottom of his heart here, we're going to listen for the mitral. And his heart sounds good. There's no murmurs, no turbulent flow through it. It all sounds appropriate. Okay, let's do an abdominal assessment. Can you lay down on the couch? Okay. So first we're going to do an inspection and look at his abdomen, and everything looks appropriate and okay. He's nice and flat. Everything looks appropriate. So I'm going to listen first for bowel sounds. So he's got good bowel sounds, and then I'm also going to look for aortic burgess, which is going to be just to the left of his midline here. And I don't hear any turbulent flow. It sounds nice and good flow through there. There's no burgess to be found. You could also palpate it if you needed to over through here. So I'm going to palpate for his spleen next. If I can go ahead and have you hold your breath, suck in. There you go, right underneath there. And there's just the slight edges of a spleen that you can feel. Okay, you can breathe for a second. I'm going to also palpate for the liver, which should be just up underneath the costal margin here. And there it is right there. You can feel just the edges of his liver. You're doing a good job. Okay, and then the last thing that we're going to do is I'm just going to walk my fingers across his belly, feel for any lumps and bumps, any pain or pressure there. Nope, so it's nice and soft. I'm not concerned about his bowels. Everything feels appropriate there. Go ahead and sit up. You can put your shirt back on. Okay. So now I'm going to look for just kind of overall extremities. So can I have you put your arms out straight, and I'm going to push them. Don't let me push them down. Good. And then you're going to push down. Good job. Okay, and then legs. I'm going to push on your feet. You pull up. Pull. Good job. And press like you're pressing on the gas. Good job. So he's got equal strength. Right here, we're going to squeeze and let go. Okay, so he's got equal strength in all extremities. He's moving all extremities appropriately. So that's a good sign. So we're going to assess pulses. And he's got good radial pulses. He's pink. He's well perfused. His cap refill is fantastic, less than 3. And your feet, I'm going to pull back and feel any pain in your calf. Okay, so that's a Holman sign if there's pain in there, and there's no pain in his calf. And as we let go, we watch for any clonus. There's no clonus there. Any pain in that calf? And no clonus there. So he's appropriate. I'm going to put your feet up here. And I'm going to check pulses in his feet. So the dorsal pedal and then also the posterior tib. And those are both appropriate. On both feet, I can feel them good. And then I'm going to check for a popliteal pulse. That one's a good pulse. Right there behind his knee. So he's got good pulses throughout. A good cardiac assessment. I don't see any swelling or discoloration in any of his limbs. Okay. Now, I think the only thing left we have to assess is for the deep tendon reflexes. So we're going to start with the brachial. It's right here in his arm, right in the middle point, right where if we need to find it, he can flex and we can find it right through there. We're going to go ahead and let you lay limp, and we should see a little bit of contraction here and a little bit of flexion there. Oh, got a little bit there. I don't have a hammer, so I'm using my stethoscope, but ideally you would have a reflex hammer. So now we're going to try the tricep deep tendon reflex, which is going to be just above the elbow here. You can feel right there where the tendon comes across, and we're going to let him hang limp. And we've got a little bit of a reflex there. The last one we're going to check is the brachial radialis, and that's going to be just above his arm right here. And we've got a little bit of a flexion in his hand, which is exactly what we want to see. Okay, so we're going to move down here and we're going to do the patellar, which we're going to let his leg hang limp. And we've got a little bit of a flexion there with that. And then the last one is the Achilles tendon. We're going to pull back, and it's just right on the back of his heel right here. And we got a little bit of a reflex with that as well. And then, of course, we would test the other side, similar to make sure we have equal reflexes on both sides. But that is all. Thank you for being here.